Well, good afternoon, and thanks to all of you for joining us today. Today, I want to talk to you about Phase 1, both statewide and also in Northern Virginia, and when the DMVs may open.
27, which is an increase of 36. Total tests are 180,084, and as the governor mentioned, that includes the 8,845 tests in the last 24-hour period. The number of African American cases that we have is 4,337, which is about 23% of the cases for which we have demographic information on race and ethnicity. The Latinx cases number 7,711, which is 43% of that same denominator of cases with race and ethnicity. In terms of deaths, African American deaths are at 201, which is 25% of the deaths, and the Latinx deaths are at 73, which is about 10%. As the governor mentioned, as we move into Phase 1, it will be critical for us to continue to contain the spread of this disease through testing and ramping that up, identifying cases as they present, isolating those cases from other people, and contacting the folks who have come into contact with that case and possibly have been exposed to the disease. As the governor mentioned, we are processing currently about 3,000 applications. We will be hiring supervisors in regional areas for this new additional workforce of contact tracers who will augment the some 604 contact tracers that we currently have in place. We plan to step up that workforce to near 1,300 people across the Commonwealth. As I mentioned previously, what this represents is about having 15 contact tracers for every 100,000 people in the population. This is a number that we got from the researchers at Harvard University who published the roadmap to ending the coronavirus epidemic, in which they said that you needed a minimum of at least that amount, somewhere between 15 to 30 contact tracers per 100,000. We will start at that 15 per 100,000 and ramp up from there as needed. Thank you.
We'd be glad to take your questions.
Yeah, about contact tracing, I was hoping to clarify what will happen when you identify the contacts of the cases that we're picking up through testing. When these tracers find a contact of a positive case, will those people then be able to be tested? Will they be required to be isolated? What happens?
Yes, so the question is, how does the contact tracing process move forward? And would you like to?
Happy to address.
Thank you.
And Dr. Furlano may correct me if I missed something. When we identify someone who's a contact, that's someone who may have been exposed to the disease, we first of all want to find out whether or not they're feeling well, what their symptoms are, and so on. If it appears through that conversation that they're actually symptomatic and need testing to find out whether or not they have COVID-19, then we would arrange for that testing to occur. And if they are a primary contact with significant exposure to the index case, then we would ask them to self-quarantine and then follow up with them through that 14-day period to ensure that they don't develop symptoms and need care.
Do you have a definition for primary contact?
What I mean by primary contact is if I'm a case and you and I have been standing within 6 feet of each other talking and so on for longer than 10 minutes, you would be a contact who we want to self-quarantine. But if you then spent time with Henry, that secondary person wouldn't be someone that we would isolate.
The first question on the phone will be from Alan Suderman at the Associated Press.
Hi, good afternoon.
Good afternoon,
The
Alan.
White House on Monday recommended that states start testing or make sure they test every nursing home resident and staff in the next 2 weeks. Is that something that's that Virginia is able to do? How many nursing home residents is that? Is that a doable target? And then one other question on the phase one is, I just want to clarify, it's just Northern Virginia that is being delayed. If any other locality between now and Friday asked to delay, is that a possibility, like the Eastern Shore or the city of Richmond?
Alan, I'm going to be nice and answer both of your questions today, but I appreciate them. To date, we have only had one locality, one region that has requested through their leadership, as you just saw, to delay entering phase one. If there are other regions in Virginia that have concerns, that have been following their metrics, that feel that they aren't ready to enter phase one, I haven't heard from them personally, and I would encourage them to go through the same process that the folks in Northern Virginia did. But to date, the only region that we've heard from is Northern Virginia. The first question that Mr. Suderman asked was our nursing homes and our goals on testing not only the residents but the staff at the nursing homes. And just an estimate, we have about 260 long-term care facilities in Virginia, and we are committed to testing all of those facilities. Alan, your question, part of your question was, will that be done in the next 2 weeks? That perhaps is a bit of an ambitious goal, but we're going to test these facilities just as quickly as we can. As you have heard me speak before, we have the National Guard that's helping us. The nursing homes also have the ability to contract through private testing facilities such as Quest and LabCorp. And as you know, we have relief funds that have come into Virginia from the CARES Act, and we are working with our Secretary of Finance, Secretary Lane, to make sure that we have the available resources that we can help nursing homes do that testing. So the approach is going to be an all hands on deck for our nursing homes, and our goal is to be able to test all of them. And I think another thing that people need to realize is that if we're able to test all of these in, let's say, the next 2 or 3 weeks or however long that takes, there may be reasons that we need to go back and test the facility again. So this is going to be an ongoing process, and the more staffing, the more PPE, the more testing capabilities we have, the better able we'll be able to do that. But you've heard me talk about this before. The nursing homes, the long-term care facilities are some of our most vulnerable population, and we are doing everything that we can to keep the residents of these facilities and also the staff of these facilities healthy.
Yeah, so experts have said a surge of cases is inevitable following even a partial reopening. So does your administration have any specific modeling on how these policy decisions could impact hospitalizations and new cases in the state?
The question is as we ease the restrictions and enter phase one, there is the potential to have increased cases. And Jackie, the answer to your question is yes, we do. And we're in a position to enter phase one because we have the hospital capacity, because we have PPE, because we have the testing capabilities. And so all of these parameters will continue to be followed. And you know, even we talk about if there are more cases in the next few weeks, we're ready for that. The other thing, quite realistically, that we have to think about, what about this fall and winter? Assuming there's no vaccination, there's no cure, if you will, for this, we've got to be ready for that. And so we're not only preparing for tomorrow, we're preparing for months and years down the road. And I think, you know, speaking on behalf of not only Virginia, but this country, we were caught flat-footed by this pandemic. We weren't ready. We didn't have the testing capability. We didn't have the PPE, and we've learned a significant lesson. I know we have here in Virginia, and so we'll be ready if there are increased cases this month, if there are increased cases this fall or next year. We're planning ahead for that.
Quote specific numbers on hospitalizations? Do you know that off the top of your head? Like on what that modeling shows, we could have X amount more hospitalizations.
Well, I think the question is about our hospitalization capacity, and I think you've seen, and I could go back and show you the graph again. We have capacity up to a certain amount, and then we have a surge capacity that's available. But I want to kind of follow up on your question a little bit. You're asking a lot of questions that we don't have answers for, and I will remind Virginians that this is a novel virus. We're learning every day how it affects human beings. We're learning every day how it affects children. I mean, a month ago, we didn't see this Kawasaki syndrome, this inflammatory vasculitis process. And so for me to sit here and say exactly what we'll need next month or a year from now, it's pretty difficult to say exact numbers. But I will tell you that we're preparing for the future, and we'll be ready.
I will
remind. The question will be from Roger Watson with the Farmville Herald.
every day.
Thank you, Governor. At state prisons where outbreaks have occurred, have the staffing levels been reduced to protect employees from the virus? And if so, what percentage is the staffing level currently at?
If you could repeat your question, I'm going to have Secretary Moran come up here, but there were a couple words in your question that we couldn't hear. If you could just repeat your question, thank you.
Sure. At state prisons where outbreaks have occurred, have the staffing levels been reduced to protect employees from the virus? And if so, what percentage is the staffing level currently at?
Thank you, Governor. Having to do with the outbreaks at our state prisons and the staffing levels to accommodate the security of those prisons, we have not experienced a significant staffing shortage. Great commitment on the part of our correctional officers. Also, we're taking steps to separate where there is an outbreak in a particular unit. DOC takes extraordinary steps to make sure that that unit is separated from others. Protections for our correctional officers in terms of their DOC masks and other hygiene that is provided. So, and I do again want to thank the effort with respect to testing at our correctional facilities. This week we did Dillwyn, thanks to the Guard and Dr. Flarno's group and VDH and others, to make sure that we can do point prevalence testing at our correctional facility so we know how many individuals are indeed infected. As we know, you can be asymptomatic. With that knowledge, DOC can take steps to make sure we separate, quarantine, and take all the appropriate CDC recommended guidelines and actions to ensure the safety and health of those in our custody.
Thanks, Brian.
Thank you, Governor. For those who applaud you and say thank you for placing health over wealth, and they are excited about your decisions to keep Virginians safe. On the other hand, some say that you've ruined the economy, you've hurt people's livelihoods and their lives. How do you talk about the painstaking decisions and work that your administration put forward in dealing with those two dynamics? And then on sidebar, when it comes to some of these restrictions, with a lot of our law enforcement entities already being understaffed and taxed, is it too much for them to maybe go to restaurants and make sure people are following procedures, go to churches, go to barber shops and beauty salons?
Great questions. And the second one, let me just answer the second one first, if I could, and that's will we be able to enforce the guidelines that we have in place? And the answer to that is yes, we will. Again, we were asked for the cooperation of Virginians, and I think for the most part we have received that. But if there are some individuals that don't want to abide by our rules, we will give not only the agencies such as the Department of Health or the ABC or law enforcement the ability to go in and enforce the guidelines. So again, you've heard me talk a lot. I'm a carrot person rather than a stick. But we will have a stick if we need to use it. But we will continue to encourage Virginians that they're all part of this solution and moving towards phase 2 and phase 3. The first part of Andre's question was the decisions that we make regarding the health crisis and the economic crisis. And I think that's a really fair question. And we realize that we are in the middle of a health crisis. We are also in the middle of an economic crisis. You've heard me talk about this in the past. Until we can get the health crisis behind us, the economy will never recover. So my emphasis, our administration's emphasis, and I think really Virginia's emphasis has been on the safety and well-being of Virginians. And so we'll continue to emphasize that. That will be our focus. But we also realize that the economy plays a part. People have lost their jobs. People are making tremendous sacrifices. And so we will all continue to work together to put this health crisis behind us, to get it under as best control as we can. And that will allow us to move forward with economic recovery. And Andre, I know you've heard me say this before, but we live in the best state, in the best country in the world. And going into COVID-19, we were number one in the country as far as our business environment. Our unemployment rate, if we remember back, was 2.6%. It was one of the lowest we'd had in many years. The amount of capital investment in the last 2 years that had come into Virginia was record-breaking at close to $30 billion with a B dollars. And so we were strong prior to COVID-19, and if we continue to work together as a Commonwealth, we'll come out of this as strong. So that's my goal, and that's what I'm committed to doing as governor. We'll look forward to seeing you on Friday, and this is just planning for all of you, and I know planning is important, and unless I hear differently, we have Memorial Weekend coming up, which starts on the 22nd, Memorial Day being on the 25th, and after that time, because Memorial Day is on a Monday, we will have these press conferences on Tuesdays and Thursdays, so we'll go from 3 a week to 2 a week. You all don't have to stand up and applaud all at one time, but anyway, that's the plan as we move forward. But it's very important to me and hopefully to you that we continue to provide you updated and accurate information. And so if we need to have other press conferences or if we need to release more information to the press on days other than when we're having our press conferences, we will surely work with you and do that. So we'll look forward to seeing you all on Friday. Thank you all so much.